Can you identify the signs of a speech, language, or hearing disorder? Imagine a 9-month-old baby who doesn't respond to her name, or a 2-year-old who has no words or maybe just a few spoken words, or maybe a 4-year-old whose speech is so very difficult to understand that even his family members don't know what he's saying. Any child older than 6 or 8 months who doesn't make eye contact or seek to communicate with others. Each of these is an example of a sign of a communication disorder. Now, speaking and listening makes it possible for us to communicate our hopes, our dreams, our aspirations, our fears, our goals, and think about how isolating and frustrating it would be if it was impossible for you to communicate effectively with those around you. Speaking and listening forms the foundation for reading, writing, and academics. And so early identification of a possible disruption in the development of these skills is critically important. Now, parents are busy, and it might be very tempting for them to take a wait-and-see approach about any concerns they might have with their child's speech and hearing. Perhaps this is because they think the child might outgrow it. But if left unattended, even for children who eventually catch up, those negative consequences tend to resurface in areas related to academics, social skills, and eventual vocational pursuits. And this is due to lost opportunities to acquire key skills and concepts in the developmental sequence, many of which may not be recoverable. Now, here are some key figures related to the prevalence of communication disorders in the United States. About 40 million Americans have a communication disorder. That's about 11% of our population. 6 to 8 million people struggle with language disorders, and that could be in listening to the language and understanding the language of others, or in using language to explain their wants and needs. It also could be related to both of those. And about 3 million people are stutterers, with about 1 in 5 Americans having a hearing loss in at least one ear. The American Speech Language Hearing Association, ASHA, considers communication to be a fundamental human right. ASHA certified audiologists and speech language pathologists are highly trained professionals who can treat and identify these and other communication disorders to ensure that all people have the right to communicate. But time is of the essence. Research has shown over and over again that early intervention is the key to successful treatment outcomes. Not only will the outcomes be more successful, but treatment is shorter in duration and less expensive. And for some communication disorders, if caught in the early stages, they can be completely prevented or eliminated. ASHA has developed the Identify the Signs campaign to provide parents and the general public with information on how to recognize the early signs of communication disorders and to find an appropriately certified speech-language pathologist and audiologist. So what are your next steps if you have concerns about your child's communication or the communication of a child that you know? We'll go to identifythesigns.org and read about the information there on speech-language disorders and hearing loss. Then click on the Ask for Help button, where you can find an ASHA certified audiologist or speech-language pathologist in your area. You can also contact ASHA directly at the 800 number that's provided under the same button. And finally, and I think this is most important, please be sure to share the information on this website, as well as the website itself, with everyone you know. Imagine what we can do to make a difference in the lives of children if we learn to identify the signs of a communication disorder.